I will begin, and you all can formulate your questions as you listen to our speaker. I am very pleased and privileged to introduce Dr. Lisa Marsch, who is the founding director of the Dartmouth College for Technology and Behavioral Health, which is a designated center of excellence and is supported by the National Institute on Drug Abuse, which many of you know as NIDA, which is within the National Institutes of Health here in the US. The center is an entity that uses science to inform the development and implementation of digital health tools to deliver for behavioral health interventions. Dr. Marsch's work in technology and addiction treatment has been particularly outstanding, and she is recognized internationally for having led the development of one of the most widely tested and evidence-based mobile interventions for addiction treatment. So we want to really have you ponder, how the nexus between our behavioral health interventions and technology is influencing your work and our work together. But we're very privileged to have Dr. Marsch, who is a leader in the delivery of science-based healthcare, and we're privileged to have her here today. And with that, I will turn the program over to Lisa.
Great. Well, thank you so much, Nancy, for that introduction. I am delighted to be here with all of you, and a big thanks to Michael Botticelli for inviting me to join your group. I was really excited to learn about the development of the Global Recovery Network. What a phenomenal organization. I'm just so excited to meet you all and to learn more about your interests and the work that you're doing. And so I have a presentation here, but I will surely be watching the clock so that we preserve a good amount of time for discussion. And I'd love to hear your comments and questions and learn more about the work that you all do all over the world. So thank you for the opportunity to join you today. So as you can see from my slide here, I'm going to be talking about something called digital therapeutics as applied to behavioral health. So we're going to talk about digital tools that have been applied to issues like mental health and substance use and recovery processes. And my goal is to describe to you sort of the state of the science of these tools and show you some samples of data that have demonstrated the clinical utility of these tools. And then we can talk about the future. And there's a lot of exciting development and research in this space. And undoubtedly, I think this will be a core part of our future of healthcare broadly. So I'm excited to meet with you all. So let's move forward. Some of the data that I'll be sharing today are from research studies that have been supported by the National Institutes of Health in the US. And I wanted to definitely acknowledge the appreciation for the grants supporting the research that I'll be highlighting today, including we have a center grant from the National Institute on Drug Abuse for our Center for Technology and Behavioral Health. And I'll tell you a little bit more about the center later in the presentation. But briefly, we are charged with being a center of excellence in the application of digital health to addiction and recovery and related issues. So if you have interest in this space, feel free to follow up and love to learn more about your work. And we have a lot of resources related to this topic that may be of interest. In addition to my academic affiliation, which is at Dartmouth College in the US, I also have an affiliation with a few companies that are involved in digital health listed here. And as I tell you more about our center, I'll highlight some of the activities we've been engaged in to partner our scientific research center with other partners, including in industry, to best scale up access to digital health tools that really can impact people's daily lives. Okay, so here's the topic of the day. It's digital health. And perhaps you've heard of this term, but broadly, it is a term that applies to using digital technology, not unlike a phone, right? A mobile device that many of us have within arm's reach at most moments of the day. And to use these types of digital tools to both measure health behavior in daily life and get insights into sort of the ebbs and flows of health behavior in daily life, but also to provide therapeutic resources to people anytime and anywhere. So these can be interventions delivered on digital platforms like a mobile device. And the idea is that this is anytime, anywhere healthcare. So there's a big landscape of digital health technology, and I'll just highlight some of that and then highlight the piece of this that we're going to be focused on today. So as you all know, we have many apps out there promoting wellness and support health behavior in daily life, like lifestyle apps and activity trackers. Perhaps some of you wear these to measure your steps or your activity. And these are general sort of wellness promotion types of apps. And then we also surely have digital health tools focused on diagnosis and monitoring patients with remote monitoring, for example, through sensors, through wearables. And that's another component of this broader digital health ecosystem. And then what we're going to largely be focused on today is the last part here on therapeutic interventions. And these are clinical interventions that are delivered directly to people through digital platforms as they live their daily lives. And the term digital therapeutics specifically relates to medical grade software that is effective in preventing, treating, or managing a disease or disorder. So that's the definition. So you're taking a clinical grade intervention, you're taking the active therapeutic processes of that intervention, and you're delivering it through the functionality and the content of software. So this can be something that complements telehealth, right? Telehealth is where we have synchronous, real-time communications with a clinician through a digital platform. But this is different. This is software delivered, right? So there's no real-time contact with the clinician in most of these tools, but rather the actual therapeutic components of the intervention are delivered through interactive software. And so why is this potentially of value? So there are several exciting sort of benefits of these types of tools. One is that this type of tool, a digital therapeutic, can be what some people call a clinician extender, right? These can be resources that extend the reach and the impact of clinicians. So they can be with a patient 24/7, even when the clinician is not with them, and can provide therapeutic support to people anytime and anywhere. So it's kind of like a clinician in your pocket, right? So it's something that's on demand, accessible, that can be meaningful to you in your life when you might most need it. So for example, someone in recovery may be feeling at risk of relapse. It might be 2 o'clock in the morning on a Saturday night. Maybe they have no one to talk to, but they may have something on their phone that they can engage with that might help them successfully navigate that moment without relapse. Another benefit of these types of tools is that they can deliver interventions with fidelity. So we can embed sort of the state of the science, the state of the art types of tools in this software, and we can ensure that it's going to be delivered in a way that is aligned with fidelity to best practices. I would love to hear when we get to the discussion what you all are experiencing in the parts of the world that you live in. But what we've seen in some of our work, including in low and middle income countries, is that many populations, even some of the most traditionally underserved communities, often have mobile devices. They may not be smartphones, but often increasingly, this is something that people are gaining access to in many pockets of the world. And so it's a tremendous opportunity to harness the widespread availability of these types of tools to provide people very personalized healthcare resources. So the scalability is exciting, right? The opportunity to scale tools that can be meaningful in people's lives. We definitely saw with the global pandemic that there was an increased demand for remote models of care that surely included remote models of care through telehealth, but also included a big growth in interest in these types of digital therapeutic tools. And I'll show you some data, but there's now decades of research that have shown that if you develop these tools well and in a way that really brings value to your target audience, that you can have a really robust impact on many types of health behavior and on health costs and on health outcomes. And today I'll show you examples, particularly in the realm of recovery from addiction. So this slide highlights about 2 decades of research, just to give you the sort of a big picture of what the data show. And what we see is that if these tools are developed well, and we'll talk more about development, but how you develop these tools is really essential, and really creating something that is understandable and relevant to the lives of your target audience is critical. And engaging your target audience in development at every step of the way is critical. But if you really embrace best practices for development, we have seen now that you can get high usefulness, high acceptability among many diverse audiences. We've seen that you can have a large impact on many types of health behaviors and health outcomes. We've seen in some studies now that a digital therapeutic can produce clinical outcomes that sometimes are comparable to or even better than clinician-delivered treatment. And I'll show you some data around that. But I want to pause here and really highlight, this is not about replacing clinicians, right? We know that we have challenges globally in having sufficient workforce to meet our population level needs for recovery support and our population level needs for mental health support. So I think these data are useful in that they show that these types of tools can really be meaningful and clinically effective and can have value as part of integrated approaches to care for recovery support. We have seen that they can increase the quality and the reach and the personalization of care, and I'll give you more examples of that. I'll also highlight some data showing that these tools can be cost effective. They can save healthcare costs, and they can be adaptive. They don't always have to work the same way, right? It doesn't always have to be, 8 sessions of a certain cognitive behavioral intervention or 12 sessions of another intervention. It can be very adaptive to what people's needs might be. And so, for example, someone early in recovery may have different needs than someone who's been in recovery for a very long time. And so we can have tools that can be flexibly responsive to what an individual's needs might be in the moment. So here is an example of some research, and I'll walk you through this slide. This was one of the early studies that was evaluating a digital therapeutic for treating people who were seeking to change problematic drug-taking behavior, right? So these are people seeking outpatient treatment, specifically in this study for opioid use disorder. And this study was done in the US. And we continue to have a significant opioid use crisis and overdose crisis in the US. And in this study, everyone received medication. We know that medications are life-saving as part of treatments for opioid use disorder. But in this study, which was a clinical trial where people were randomized to different types of behavioral interventions on top of the medication they were receiving, we randomized participants to 3 different study conditions. So they could go into one of 3 different study conditions. This is just a snapshot of the study. If anyone has any interest in any of the studies that I described today, I'd be glad to share more detailed papers with you that give you a lot more detail about the studies and their results. So in this particular study, participants who were randomly assigned to join the condition that's reflected here in the blue column, they were provided with therapy through in one-on-one therapy sessions with a trained clinician who was trained to deliver one of the most evidence-based behavioral therapies for addiction treatment, and it's an approach called the community reinforcement approach. And it's been widely studied. It has a lot of support for being useful as part of care models for substance use disorder treatment. So these clinicians were delivering that 3 times a week to participants in this blue column. In what's shown in the red column here, these were participants who had a clinician and they checked in with them every other week, but this model of treatment, this community reinforcement approach to behavior therapy, was delivered entirely through a digital platform. So they interacted individually with the digital version of this therapy. And participants who were in this column, the gray column here, were provided with what was reflective of standard counseling in opioid treatment settings in the US at the time of this study. So what you see from this study is that even when we offloaded a large part of the behavior therapy to the digital delivery platform, we had comparable outcomes to exclusively clinician-delivered care. And both of these versions of this evidence-based therapy produced better outcomes than standard treatment. And this was on an outcome measure of documented negative urine samples, negative for opioids and cocaine, which were the problematic substances in this particular participant sample. So that's one study. Here's a different study. This was done in the US in methadone treatment systems in New York City. And in this study, adults entering methadone treatment at our collaborating sites were either provided with standard treatment at that setting, which is reflected here in the yellow column. And methadone treatment includes daily access to methadone medication, as well as some case managing and counseling support from clinicians at the site. Or if they joined the study, they could have gone into what's reflected here in the blue column. And in that condition, they were provided with all of the resources I just described at the methadone treatment setting, but their contact time with their clinician was cut in half, and the other half of that time they spent interacting with this digital therapeutic for substance use treatment that I briefly described. So, for example, instead of meeting with a clinician for 60 minutes, they would meet with them for 30 minutes, and then they would spend the other 30 minutes interacting with this digital intervention. And what we found in this study is that when we cut in half clinician-patient contact time and replaced it with this digital version of this evidence-based behavior therapy, we greatly increased documented weeks of opioid negative urine samples in that group compared to the participants who were in standard treatment at the treatment setting. And in this study, which was funded by the National Institute on Drug Abuse in the US, we had the opportunity to track participants' clinical outcomes for 12 months. And this type of difference you see across the two study conditions persisted for 12 months. We saw an advantage for that full year for people who got access to this digital tool as part of treatment. And we can surely talk about why this might have happened, but briefly, this is a very interactive digital tool that's delivering with fidelity one of the most potent behavior therapies for addiction in a very individualized way that really responds to each individual user and really ensures learning at that individual level. And then another example is a very different kind of research design. This again was in methadone treatment for opioid use disorder. And here we didn't touch in any way the underlying model of care offered at the treatment facility, but rather we in this condition, those who went into this condition reflected in blue were given, on top of standard treatment, access to a mobile version of this digital therapeutic. So it was a supplement to standard treatment. So what we found here is that if we gave people this mobile digital therapeutic on top of standard treatment at this methadone treatment facility, we retained a much larger percentage of that sample in treatment compared to those who received standard treatment. And we know that retention in treatment is a really important part of longer-term positive clinical outcomes. So this is retention in the treatment program. And here we're looking at retention during the first 3 months of someone's treatment episode. The same pattern emerged when we looked at urine toxicology data, particularly looking at opioid negative versus positive urine samples. And again, we had more documented weeks of opioid negative urine samples in the group that got access to this mobile digital therapeutic versus those who received standard treatment only. And this pattern of results I'm highlighting to you has been replicated now in multiple different studies, including in a very large national study in the US that the US National Institute on Drug Abuse funded through their Clinical Trials Network platform, with a very diverse array of substance users, like using stimulants and cannabis and alcohol, as well as opioids and polysubstance use. And that large national trial saw a very similar pattern of results to what I'm showing you here. Okay, so this particular digital therapeutic has become available outside of research settings in the US. And so we have the opportunity to look at what's called real world evidence, right? So this is with people that are getting this offered in clinical settings, not participating in research. And what I was really struck by when these data came out is that the real world evidence data, the clinical outcomes of people who experienced this tool clinically outside of research, was these outcomes were even better than what we saw in clinical trials outcomes. So if you look, for example, at the clinical trial data, in what's called a responder analysis, where we look at when we have at least 80% or more negative samples for opioid use, we had very compelling data in the clinical trial, 78% responders, but the real world evidence data with the first 3,000 or so people who got this showed 91% of that sample responded on this metric. And there are many other studies now that are out there that show similar types of patterns, not just for recovery support, by the way. We see very comparable outcomes for example, digital therapeutics for insomnia treatment and other types of health conditions. But what's also really interesting is that the state of Massachusetts in the United States did their own study looking at residents of the state of Massachusetts who were covered under the Massachusetts Medicaid program. And they found that for the first cohort of residents in the state of Massachusetts who received this digital therapeutic, they saw in their data a 45% reduction in emergency department visits among those individuals and a 64% reduction in hospitalizations. And this is really exciting. And again, we've seen this replicated now a few times because, not only is there opportunity to increase, improve clinical outcomes, but also, these types of tools may have significant implications for healthcare expenditures and opportunities to reduce healthcare expenditures, right? So if you have something in your pocket, right in the moment when you might most benefit from it, perhaps that can help prevent you from relapsing or overdosing or needing to go to an emergency department, for example. In the US, we now have prescribable software. So we have software that clinicians can prescribe to patients. And this is called Prescription Digital Therapeutics. It's under our US Food and Drug Administration regulatory oversight. And the way it works is you can take data from a clinical trial to the US FDA and seek to get this status under their category of software as a medical device to claim that your software is safe and effective in preventing, managing, or treating a medical disease or disorder. And if you meet all the criteria for this, then your software can be prescribed in this country. And that's what is happening in the US. But yeah, I'm really eager to hear what you all are seeing where you live. There's been a really large surge of activity in digital therapeutics in many parts of the world, including in Asia, in Europe, in Australia, and other parts of the world. And there's a wide array of paths to getting these out there. Some countries have national coverage frameworks. Some have other ways to deploy these types of digital therapeutics. I showed you some data on the clinical effects that we've seen in research among people in recovery from substance use disorders, but I just want to give you a snapshot of other data that we have seen where these tools have had comparable clinical effects on many other health domains. So, for example, we've seen most of the tools that are available right now are for mental health indications. And for some of these tools that really reflect the state of the science, we see that you can get big effects on things like anxiety and depression and attention deficit disorder and post-traumatic stress disorder, obsessive compulsive disorder, and various types of serious mental illness such as schizophrenia. We've seen that it can improve remission rates in certain mental health conditions. We have also seen applications to people living with chronic pain and seen that this can impact chronic pain outcomes, including, reducing catastrophizing over chronic pain, but also reducing emergency department visits among people living with chronic pain. As I mentioned, we've seen implications for healthcare costs for many different clinical populations. Some of these tools are designed to promote medication adherence and to help people be compliant with different medical regimens. And we've seen applications again with many different mental health conditions. And also several studies have looked at more functional outcomes in people with various mental health conditions, and again, shown promise. So I just want to give you that snapshot. I also want to highlight, I mentioned this briefly earlier, but it's incredibly important how you design these tools and ensuring that your target audience is a key part of every step of the process, from how you conceptualize what the digital tool might be, to how it works, to understanding, is it, comprehensible and usable by your target audience? Is it relevant to their lives? Does it add value? You know, if people engage with it, does it help them achieve goals in their life? And so at every stage of development, testing, refining again, it's really key to have your target audience involved. So, you know, we even work on a lot of drug abuse prevention types of tools for kids, for example. And we have kids as part of our development team, and it's really essential that that's the case. So whatever population it is, it's really critical that you understand the needs and what could be of value and co-develop these tools together and evaluate these tools together. So I think we have a really interesting moment of opportunity globally with these digital health tools. We, first of all, have seen a ongoing demand for remote care in many parts of the world, particularly where there may be challenges in having enough healthcare providers to really meet a community level need. Unfortunately, we have seen a global increase in our behavioral health needs, surely in mental health, and in some communities in substance use needs. We've seen a lot of growth in industry in many parts of the globe in digital health tools, not just digital therapeutics, but there's been a lot of investment. And if you're not aware of it, actually, it's not just digital health startup companies, but there are multiple global pharmaceutical companies that are now building digital health formularies, including digital therapeutics, which can be standalone types of digital therapeutics or can be used in combination with all kinds of other models of care, including medications and other types of therapeutic approaches to extend the reach of clinicians. We now see multiple paths to deployment across the world. Even in the US, I mentioned we have this regulatory pathway where you can get prescription status through the US Food and Drug Administration, but there are many other ways, even in this country, around, you know, going through pharmacy benefit managers or employers who offer these tools to their employees. And then we can talk more about this, but there's an evolving payment landscape in many parts of the world as well to provide coverage for these types of tools as part of healthcare. So what I'd like to do now is give you a sense of how you could use these types of tools to embed them into the clinical workflow of a healthcare delivery model, right? So I'd like to show you, going beyond the clinical trials types of data, if you take digital tools and embed them into healthcare settings, how do you do that, and what could be the value of that? And so to highlight this, I'm going to show you an example from a project we had the opportunity to conduct with a broad array of just terrific partners in Latin America. And this was funded by the US National Institute of Mental Health, but all the work was done in Latin America. So starting in Colombia, you see a picture here of Colombia. Colombia, as you may know, is a part of the world with high mental health burden. The country was touched by very long, many years of armed conflict. There was a peace agreement, at least 6 or more years ago. But if you look at the data in the country of Colombia, we see very high rates of trauma. We see very high rates of depression, and also high rates of unhealthy alcohol use, often accompanied by domestic violence. And this is when we started the study, it's high mental health burden, but the challenge that we were tackling is, and this is, not unlike many other communities in the world, was that we had this high mental health need, but we had very limited mental health professionals to meet that need. So if you went to Bogota, for example, you could find some mental health professionals, but if you went to a rural farming community, there wasn't really nothing. You might have inpatient psychiatric hospitals, but in terms of some of the mental health conditions I described, there was very little access to mental health care. And so what we did in this project was to see if we could use a suite of digital health tools to help scale up access to science-based behavioral health care in the region. And here are some of the communities on the map that we had the opportunity to work with in. So here's what we did. Although we didn't have mental health care systems across the country, we did have primary care across the nation. And so this was a partnership with primary care across the country of Colombia. And surely there was a lot of training involved because this was the first time that primary care systems in Colombia screened and treated mental health. So mental health was not part of what was being assessed in primary care. So there was definitely a lot of support to providers in embracing mental health as an important component of primary care. But then we leveraged an integrated suite of digital health tools that had strong scientific support to help embed science-based screening and treatment into the clinical workflow of primary care. So, for example, we had a digital health screening platform that was all automated that used standardized screeners for things like depression and unhealthy levels of alcohol use that patients could complete on a digital interface. And then the provider received a digital clinical support tool. So this is a tool that helped the provider help walk through for the patient right in front of them to understand, do they have a diagnosable mental health condition? And if so, what could reflect best practices for therapeutic support and treatment for that individual? And then in addition to what was happening in the primary care setting, every patient who received a diagnosis received a digital therapeutic. And this was a platform that could help them be 24/7 accessible on mobile devices to help support them in managing depression and high levels of unhealthy alcohol use. So here are some screenshots just to give you a flavor of what this looked like. This is the digital screening that patients would complete. This is an example of the clinical support tool provided to clinicians to walk them through, to be their guide, basically, to walk them through best practices in diagnosis and treatment. And then these are some screenshots from the digital therapeutic. This was, we've had a chance to work in digital therapeutics for a long time. And so we took sort of the learning of what has been shown to be most effective in these digital platforms to treat a wide array of issues, not only alcohol use, unhealthy levels of alcohol use, but also mental health. And we were able to embed this into a digital platform that could flexibly provide different therapeutic interventions based on whatever combination of mental health needs a given patient had. We worked extensively with the country of Colombia to not only translate it to Spanish, but make it culturally relevant to the region. So just to share some data with you, this is a snapshot of the first couple of years of this study. And what we saw is we went from screening no one in primary care for things like depression and unhealthy alcohol use to, in that window, including over 22,000 patients who were screened for these conditions. And among those, we had almost 5,000 positive screens and then about 2,000 that received a diagnosis. So we were able to, for the first time in the region, screen and diagnose and then treat these conditions. We had the opportunity in this study to track patient outcomes for a year after they engaged in this model of care. And we had really high retention. We had wonderful partners in Colombia who were able to stay in communication with our participants for a long time. And we did this for a year. And so here just wanted to give you a flavor of some of the data, the clinical data. We saw that we had a pretty notable drop in depression symptoms when people were exposed to this model of care that generally sustained over time. And we saw that this pattern was generally the case even when people had more severe levels of depression symptoms when they joined this model of care versus those that had more moderate or mild levels of depression symptoms. We saw that all three of those groups were able to show clinical benefit from this model of care. Here are the data for high levels of unhealthy levels of alcohol use. Again, higher levels at baseline, and then showing improvement over the course of the evaluation period. And again, even for those who had very high levels of problematic alcohol use when they joined this model of care, we saw that those folks, as well as those who had more moderate and lower levels of risk, showed a response and reduction in these levels. I won't go into every data point on this slide, but one of the main things we looked at in this study was the implementation of this model, right? And the acceptability of this model in primary care, the perceived appropriateness, the utility, the feasibility of embedding this into the clinical workflow in primary care. And so we got these data both at the time of study launch and then here you see what we tracked for 2 years. Both administrators in the systems of care as well as clinicians, providers, completed these data for us across the country. And the big picture is that overall we had pretty high levels of adoption and perceived accessibility and appropriateness and feasibility, et cetera. Even at the time of baseline, which is interesting because we had done a lot of training on this model before we started collecting these data. And there was a lot of people perceived this as useful as part of the services that they could offer in primary care. And again, this is a detailed slide, and I'll just at a high level describe it. We also looked at costs, and there's a very detailed costing tool that you can use. This is something that came out of Harvard University, and you can assign a cost to every component of a clinical workflow, every single interaction, every component of a clinical workflow. And when you change the clinical workflow and you adopt some innovation in that workflow, you can assess how that affects cost, right? And so we did this in a very granular way in this project. And the conclusion of that very long process is that the cost of implementing this model to screen and treat mental health care added the equivalent of $1.89 US per patient per year to the cost of care compared to their prior model, which did not embrace mental health care. And so there's a lot of excitement about that because this cost allowed for the screening and treatment of mental health across the region in a way that was a low cost. So the country has been very keen to sustain this type of approach. So I mentioned that, this is an example, right? This is an example of a part of the world where we had high need and limited capacity to meet that need. And so the study demonstrated that there could be utility of using digital tools to help scale access to mental health care resources and expanded the capacity for delivering science-based care. And you could imagine that this could be useful for other areas of mental health, recovery support, other health conditions as well. I'm going to make sure that we have a good amount of time for discussion. So I'm going to jump through these slides that is more focused on, and we can talk about this in the discussion, but just briefly, I've been talking a lot about how digital platforms like mobile devices can provide therapeutic tools to people, but they can also learn a lot about people and the ebbs and flows of their daily life and their clinical status and, their functioning. And so we have also been engaging in a line of research where we can learn about people from lots of data that they share on digital devices to give very personalized interventions to people. So when someone might be at risk of relapse, when someone might be at risk of a psychotic episode, can we provide an in the moment digitally delivered intervention that's very responsive to that need in the moment? And so we've been doing some work in this space, and I'm going to skip through this and happy to come back to it if you all would like. But I also recognize that we really want to get into discussion. So I think I'm just going to jump to the last few slides here. And in summary, the data are pretty compelling that we can develop digital therapeutics that have robust clinical effects and benefits across many health domains, including recovery support, and lots of opportunity to think about, creative ways to use these in many countries around the globe. They can be useful in helping to support models of healthcare delivery that can scale up access to science-based care at a population level. And as I just briefly mentioned, these digital tools can capture rich data, very rich, granular data in people's daily lives in real time, and can then provide in real time very personalized therapeutic support as well. And this is a very exciting area of research in recovery support, and also a lot of work happening in around mental health. Our center is, again, here to be a resource. And so if you all have any interest in following up about any of this after today's meeting, I'd be delighted to chat with you. We definitely are a research center at our core, very multidisciplinary research center focused on bringing science to this space, science to the development, to the evaluation, to the implementation of digital health tools, including digital therapeutics for substance use and related issues. But we're also really focused on bringing science to people's daily lives. And, the research is incredibly important, but it's not enough, right? It's really critical to try to get the most engaging and effective tools to people and have sustainable models of access to these tools. So we have many activities that we're engaged in around that goal. And then just to give you a snapshot of some of the research happening here, in addition to what I just highlighted, we have been focusing a lot on transdiagnostic types of digital therapeutics that can embrace the comorbidity we often see in co-occurring health conditions. We've been doing a lot with these momentary interventions that I briefly mentioned. We have a portfolio of work around prevention and embedding the science of prevention and how we can build up protective factors and reduce risk factors for drug use and mental health challenges in games. A lot of that has been in interactive games designed for kids, for teens, for children and young adults who often are playing games, and so going to where kids are and embedding these prevention dimensions into the games has been really exciting, and we've got some very exciting clinical outcomes in some of the studies that have looked at this. We have a lot of activity around artificial intelligence, which is impacting so much of our world, and studying how we can embrace this and best ways to embrace this in digital behavioral health. And then, as I mentioned, we've been growing our partnerships to really, with the goal of scaling, things that work, and also learning, what kinds of data do policymakers want to see or payers want to see, so that we can ensure that our research projects are really producing data of value. So that I will pause here, and here is our website. We have a very active social media life at our center, all on this topic. If you're interested, we would love for you to join our social media communications. And here's my email address as well. So feel free to reach out for any follow-up that might be of interest. So thank you for the chance to share this. I'm going to stop sharing because I'd love to see everyone and hear your comments and questions and learn about the work that you all do. So thank you so much.
Good morning, everybody, or good day, everyone, people from around the world. As Nancy said, I'm Michael Botticelli, and I have the privilege of serving as the chair of the Global Recovery Network. Dr. Marsch, I want to thank you so much for that really engaging presentation. And I have to say that, and I'm sure I speak for other people when I say how exciting your work and your presentation was. I think it is unusually rare to see tools that increase the effectiveness of care, that expand the reach of care, that expand the quality of care, and reduce the cost of healthcare, right? So, here we have, I think, incredibly exciting opportunities to improve many of the dimensions that many of us have been trying to do for a very long time. So really want to thank you for that presentation. I want to follow up on one point before I kind of open up. So just ask folks, if you have question or comments, please raise your hand in the chat, and we'll get to your questions and comments. But before we do, you had briefly mentioned artificial intelligence, AI. It's been in the news a lot these days about both the benefits and challenges that we face here. Quite honestly, I probably don't know enough as I should as it relates to kind of behavioral therapies. But I wonder if you could just, from your kind of knowledgeable point of view, talk about like what you think are both some of the opportunities and challenges as it relates to the application of artificial intelligence and behavioral health.
Yeah, thank you for the question. So AI has touched so much of our world and continues to, and there's huge investment in AI all over the globe. And we and others have been seeking to understand exactly what you said, the opportunities, but the challenges. And there definitely have been a lot of challenges. There have been, multiple projects that have sought to use sort of, AI-powered chatbots to provide psychotherapy directly. And there have been a lot of problems with that. Largely the data that you train these on hugely impact, what happens with these, but there are a lot of challenges with putting guardrails around that. There is some work in that space that's looking more promising, but it's very early stage. I think that one of the areas that may be promising, and we at our center have been focusing on this in a number of our projects, is the opportunity to use an AI-powered conversational agent kind of as like a front end to a digital therapeutic. So this is something that isn't a therapist. It is a companion that can connect with you and learn about you in real time and over time. So it can personalize a lot of things. It might know, what has been most helpful to you when you're feeling at risk of relapse, and can recommend certain tools or resources that might be most meaningful to you, or can connect you to a whole array of the kinds of tools that I described that are really potent in these digital therapeutics. But it's like the connector, right? And it's maybe a front end. And I think what I've seen as the biggest benefit of that is that can help drive engagement, ongoing engagement with use of digital therapeutics, right? Because, we can see the kinds of effects I showed you, but not everybody continues to use these tools, and discontinuation is an issue for some people. So how can we promote more usage of something that might be meaningful to people in their lives? I think that these large language model types of AI conversational agents could be useful in that regard. And we don't have enough data to say that, definitively yet, but many people are studying that and studying how that can be useful in that way. So I'm happy if folks have more questions about this. We have a number of our researchers here that are deeply immersed in this space, and including around mental health applications. So if there's any interest, please follow up.
Great, good. Dr. Marsch, someone had a question that if they wanted to see kind of a real world example of one of the tools, is there an open source or kind of easy way for people to view these kinds of tools?
Yeah, it's varied, because some of these, different companies have developed, and they might have like a demo of their tool available, but to get the full thing, you might have to pay for it. But yes, so yes, a couple ideas. So one is there's a really great global trade organization called the Digital Therapeutics Alliance, DTA, Digital Therapeutics Alliance, and their website is fantastic. They keep it up to date. It reflects, they really keep their finger on the pulse of what's happening all over the world, including probably many of the countries that this community is from, in the world of digital therapeutics. And they keep their website very up to date about what's happening globally, but also they definitely highlight, tools that have, scientific support, or those that, for example, in the US have gotten this prescription status. So that would be a great website to go to, I think. Our website has a lot of information about digital therapeutics for substance use and related issues like mental health. There's a program review there. But there are some other examples where you could go get sort of like a free, version of a demo of some of these tools. So if anyone would like very specific examples, feel free to send me an email, and I'd be happy to try to link you to whatever you're looking for.
Great. Thank you for that. And just for folks on the call, we do write-ups of the summaries of these calls and send them out. So we'll make sure that those links are contained in the write-up of the report. So you don't have to remember or write it down at this moment. So I want to open it up to people on the call. I think we have people from all over the world on the call right now. I'd be interested in kind of your reactions to Dr. Marsch's presentation, what you might see as kind of opportunities for the people that you work with or the region of the world that you work in, or if people are using them. Love to hear kind of your real world observations about the use of these digital therapeutic tools. So anybody want to kind of start here? Be careful, I might call on people if I don't see any hands. But just want to hear people's thoughts and reactions to Dr. Marsch's presentation. Okay, I'm going to start calling on people. So Ashwin, you're a clinician.
I'm curious about the prevention things that you have, and love to hear more about those.
Great.
Sure.
So
Yeah.
Lisa, before you start, I just have to say public hello to my former colleague from the Massachusetts Health Department, who worked for me for many, many years. Kathleen, it's wonderful to see you on this call. And she is one of our kind of leading prevention experts in Massachusetts and the country. So good to see you. So the question was, hear more about kind of the prevention aspects of these.
Yeah, thank you. Nice to meet you, Kathleen. So so a lot of this work has been around, taking prevention science and what we know can build up protective factors and reduce risk factors heavily for children and adolescents. A lot of this has been for young people, and embedding them in interactive games, sometimes called serious games, that again are co-developed with children and adolescents, right? They are on the development team to make sure that this is really reflecting something they're going to use. And one of our faculty, if you have interest in this, feel free to reach out and I can connect you to Lynn Filene, is one of our key faculty who's been leading this for a long time. And she has really beautiful data from clinical trials showing that heavily school-based studies, these are often studied in schools, embedded into what students get access to, but increasingly thinking about including these types of tools through pediatric settings and other types of community-based organizations. But a lot of her work, which she's been doing now for over a decade, has shown pretty big effects in preventing things like vaping. Vaping is a big issue in the US and many other parts of the world. She's got a big study now, reducing risk of engaging in opioid use among adolescents. Also, she's done a lot of work in preventing use of nicotine with a lot of these tools with kids, but also mental health, right? She's also shown that this can impact building up sort of resilience and protective factors and skills that can help with preventing mental health disorders. So the data are quite compelling, actually, and it's been replicated. How you develop these games and is, again, incredibly important so that, that kids will use it and engage with it. And they can be a tough audience. So having them, co-create is absolutely critical. So, but, we've seen effects as young as elementary school kids where you're really building up protective factors to, high school and college level, young adult communities. So feel free for sure, if you'd like more info, to just reach out.
Thank you for that. Again, if you have a question or comment, just raise your hand and we'll get to you. But in the meantime, I want to, I'm going to ask Ashwin to give his thoughts or reactions. Ashwin's a clinician and wonder if you're using tools now or if you could see the applicability of that, or be very interested in your reaction.
Right. Firstly, Lisa, I got to say, it's very interesting to see the development over so many years. I'd always assumed that maybe this was something new, and I didn't know that, so much of work has gone into it for such a long time. Prior to this, I've been aware that there have been some of the digital therapeutics for ADHD and for anxiety and depression, but it's very interesting to see that even for substance use, and you can see some reduction in the audit scores. As for me, Michael, generally, I don't use digital therapeutics in my work. I don't know if anyone in Malaysia does. But I do use some of the adjunctive tools every now and then to kind of supplement the work, like mood charts. I think that there's some mindfulness apps. Once in a while, I would sort of utilize them. But a couple of months ago, was it sometime last year, we looked at smoking cessation. I think it was Charles University had developed a smoking cessation app. I can see it's a digital therapeutics. It's got the whole CBT interventions. It's got MI interventions. And we were sort of looking at kind of developing a program where we could also utilize some of these apps, because I think one of the points you raised, Lisa, was that in many parts of the world, at least in places where we are at, high mental health symptomology, but very few clinicians, right? For instance, like here, we don't have very many clinicians that are trained in addiction. So having an app like that, similar to the studies that you have done, where you have maybe not so frequent follow-ups, where the clinicians can sort of look at just following up and motivating, and that was something that we were sort of looking at some months ago, but unfortunately that hasn't sort of fully materialized. But I can see the application of digital therapeutics in our work. I think some of my colleagues prior to this, one or two of the rehab centers, thought of developing some applications, but the cost here is phenomenal. So that seems to be an obstacle and a barrier as well. Yeah.
Great. Thank you, Ashwin. Appreciate it. I'm sure I will mispronounce your name. Chinamaram, who is from Nigeria. I believe you're with a mental health organization. So you're on mute. So there you go. So please, love to hear your thoughts.
Good afternoon, everyone. It's afternoon here in Nigeria, and I'm glad to be in this meeting. And I'm also very excited to have heard the different inventions that is being out and is helping in this space. I didn't want to wait until after the program before reaching out to the last presenter. I came in when she was making her presentation, and I tried to grab what she was trying to say about behavioral science and the digital interventions. And I realized that we cannot keep quiet. Here in Nigeria, I work with a mental health organization. We have a rehabilitation home, and we deal with young adults between the age of 12 to 20, 25, 26, 30. In some cases, we have them 40 years that are dealing with addiction to substance use and other mental health issues. The prevalent mental health issue that we address in our rehabilitation home is substance use disorder. And it's like becoming a menace here in Nigeria. And we in the space, we are seeing so much that can be done to, curb it and to also help those recovering from addiction. So I really appreciate being here, and I'd like to know more about the behavioral science, the digital interventions that could help us with all of the mindfulness coaching, the counseling, and the therapies that are needed. We offer therapies here. We offer mindfulness coaching here. We also try as much as possible when it is needed to add medication to the treatment. That is when it is really needed. But we try to use the behavioral science techniques, modification techniques in addressing this issue and helping our clients. So I'm really, really excited. Thank you so much.
Well,
Great.
just a quick response. Thank you so much for the comments, and I'd love to talk to you more if you want to talk
Yes,
sort of individually.
I'd love to.
Yeah, that would be
I
great.
love
Please send me an email if you would, and we could talk. I'd love to hear more about what you're seeing there in Nigeria, and it's great you have an array of resources available, and these can be very compatible with that, right? And just be another tool in the toolbox of clinicians that could be offered, and perhaps help with engaging, including young adults, right? Developing with young adults in Nigeria would be really critical to make sure they're going to engage with it. But I think it'd be exciting to talk to you more about that.
Yeah.
Yes. I would like to get your email address immediately, Ma.
Okay, thank you.
One of the things that I think is really wonderful about this network is that the challenges that you might face individually are often challenges that we all face. And, this gap between the people who need treatment and the people who get it is vast. And, anything that we can do to kind of bridge that gap, I think is helpful, and, extend, I think, the services is really wonderful. Nancy, wonder, you raised a number of questions. Just wonder if you had some thoughts and reactions here, and some observations in terms of Dr. Marsch's presentation.
Well, thank you so much, Dr. Marsch. This was an incredible opening of a door to a world I literally knew so little about. And as a person who's been in recovery for 39 years and who spent many years in that sort of horrible no man's land, with an awareness that there was some support and treatment available for my disorder, but I couldn't get it. I just couldn't seem to get connection with the helping clinical community. And I just see this as being the most exciting bridge to extend the reach of science-based, evidence-based care. This is very exciting, and I think has life-saving potential for addiction in particular, and recovery support. My mind is spinning and thinking we need to have a training on this so that people can become aware of the materials that you've presented, and that maybe the members of this network could begin to be ambassadors for communicating accurately where the research is and where the potential is. Because one of the major feedbacks that we get from so many people is we want recovery support, but we're living in impoverished areas outside of, let's say, Johannesburg or whatever. And but they have cell phones, they have digital access. They just don't have access to clinical centers in their communities. So this is just, I think, huge, 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 huge. And I'm wondering, in that regard, are any of these tools available in other languages that you know of?
Yeah. Well, thank you, first of all, for the comments, and I share your enthusiasm. And I'm also really excited where we are and the opportunity we have, because I've been working in this space for a long time and would see study after study that showed what we could do with these types of tools. And to be at a place now where, there's global recognition of these, we're not where we want to be with everybody having access yet, right? But there's increased awareness. There are paths to getting these things out there. There in some communities are ways to pay for this. It's fantastic to see that there's that sort of growing recognition of an awareness of how these can be meaningful as part of healthcare resources, but we have a long way to go. And yes, there are a number of tools that are in different languages, and the best ones too have been developed to be also culturally relevant to the communities where they're going to be used. But there's a long way to go. And so I would be delighted if this network had interest in thinking about global applications. There's a lot of work to do there, but it would be incredibly exciting to see the impact that could be achieved with that kind of activity. So thank you all for the chance to join today and meet all of you. Happy to follow up with anyone.
Great. Thank you, Dr. Marsch. And unfortunately, we're just at time. I think, we just had a very exciting presentation, and I think everybody can see the opportunity. So we'll continue to work with you in the center in terms of getting this information out. We have people here from all around the world. We're joined by Fan Yang, who is our fabulous State Department lead, and can think of opportunities to do that. So thank you, everybody. I'm sorry we don't have time for kind of more questions and comments, but we're at time. So thank you again, Dr. Marsch. Really, really excited about the presentation. I just wanted, thank you. And also your generous offer to follow up with people. I think that's very, very gracious of you. So I'm just going to ask Luis, we have a couple send-off slides here for people who are interested. So Luis, if you could just put up those slides. If you are, this is in addition to the Global Recovery Network, our international partners also support it's called ICADI, the International Consortium for Alternatives to Incarceration. I know many of you probably work with justice-involved populations or are interested in this topic. So there's another network that's available that's offering similar kind of resources. And here is the QR code for that network. And I would encourage you to join that if you can. And lastly, if you are not already a member of the Global Recovery Network, we'll put up that slide with our QR code. We have been fortunate to have presenters like Dr. Marsch give us monthly dialogues in terms of issues that are important to you, and we'll be hosting other events and throughout the year. We also have a great website that has a tremendous amount of the latest in recovery-related research and resources on our website, so that you can link to that. We're trying to be a library for all of those efforts. So with that, we are finished with today's monthly dialogue. And as I said, we will, as we always do, we will have a summary of the dialogue, and we will send out the links to both Dr. Marsch's center, as well as the Global Therapeutics Network that she mentioned before. And also this has been recorded, so that will be available. So if you have colleagues that you think are interested in this topic, we encourage you to have them access them through our website. So I hope everyone has a wonderful rest of the day, however long that might be. And again, really want to thank Dr. Marsch for a tremendously exciting presentation. Thank you very much. Bye, everybody.
Thank you, Dr. Marsch. Thank you, Michael. Thank you, everyone. And go to the GRN website where you can access all this information. And Luis, if you can put up that slide with our QR code to sign us off, that'd be great. If not, you can go to our website. And we look forward to seeing you at future events. Good day and good evening to all.